Hello, I'm Gene Lehrmann, the president of AARP. I've asked the president of your chapter or the president of your unit if I could discuss with you where AARP stands on healthcare reform. As you know, the AARP Board of Directors has decided to recommend to our chapter members that they support the Gephardt bill or the Mitchell bill. We have done this because we feel it's important to bring this message to you today. In addition to that, we have had strong reactions, both negative and positive, to our proposal. We think it's important that you understand why we took this step so that we could move this whole agenda forward. You never asked me. That's a question I get very often, and it's very obvious that we can't ask each of our 33 million members how they feel about every issue, even if it is as important as healthcare reform. But we do stay in contact with our members in many different ways. We do it through the Bulletin and Modern Maturity. We carried on 6,500 forums and hearings throughout the country. Our volunteers are holding meetings and discussing healthcare reform and giving us feedback information. We continue to use polling as a method of knowing exactly where it is our members feel. It's a very scientific and a very direct way of finding out what the circumstances are. What's wrong with the current system? Well, we all know there are things wrong with the current system, but one of them that stands out is that 37 million Americans are uninsured. And when millions of them are children, that certainly reflects on the need for change in our healthcare system. What's wrong with our system? High costs are another thing that is wrong with our system. Costs are escalating for families which are at $9,000 today. They will escalate to $17,000 by the turn of the century. When we look at those of us who are receiving Medicare, our costs are escalating very rapidly. In my own case, what started out as $100 a month in payments for Medigap insurance has escalated to $261 a month and will continue to escalate if we don't do something about it soon. What are AARP's reform goals? AARP's reform goals are those that you have given to us over a period of 5 years. The first of these is coverage for all Americans that cannot be taken away. The second is comprehensive benefits that provide for prescription drugs and long-term care benefits. The third is reduction of the skyrocketing costs of health care. The fourth is to make certain that it's paid for in a fair and equitable manner. And the fifth is protect Medicare, which is very important to all of us. We have used these as a benchmark for all of the proposals that we have considered in the past few months. Can these goals be achieved? Well, it won't be easy. It'll be difficult, but it can be done. President Truman, President Nixon, and President Carter all had health care proposals placed before the Congress of the United States, and the Congress failed to act. Not since 1965, when the Medicare Act passed, has Congress seriously considered health care reform. We now have the opportunity to do something about health care reform. When the Board of Directors was faced with the fact that we had to make a decision, we took a look at all of our goals, measured those against the proposals in the Congress, and came to the conclusion that the best way to meet those goals would be to support and build upon the proposals introduced by Mr. Gephardt in the Congress and by Mr. Mitchell in the Senate. We see these as vehicles that will help bring about meaningful health care reform this year. Don't these bills cut Medicare? Yes, they do. And every health care reform proposal before the Congress does propose a cut in Medicare. We know that, and we're concerned and we oppose wherever we can cuts in Medicare unless there's a proportional benefit that Medicare recipients get from such a cut. There's a lot of misinformation out there about where AARP stands on Medicare cuts. Perhaps you've seen in your local newspaper an ad by the Seniors Coalition which accuses AARP of being in favor of Medicare cuts. That simply is not true. The Gephardt and Mitchell proposals do have Medicare cuts, but in return for that, we get long-term care and prescription drugs. That's a very important difference. On the other hand, the mainstream proposal, which AARP opposed, did not give us anything in return for the Medicare cuts that they're proposing. AARP will continue to oppose any of these plans that give us cuts and no proportional return for Medicare recipients. What will reform cost me? That's a difficult question to answer because we do not have a final proposal before us. You have told us over and over again that you're willing to pay your fair share if it's equitable. AARP will hold to that goal. Remember, the most expensive option will be to do nothing at all. What's ahead? This is an historic time as far as healthcare reform is concerned. In fact, it's a once-in-a-lifetime opportunity. AARP will continue to work to meet its goals. We're asking you as chapter and unit members to join us in informing your state legislators and national legislators about these goals. Our volunteers will work with you in making certain that you get the information in regard to each of the proposals. I've been involved in this issue for a long time, and I thank all of you for your efforts on behalf of healthcare reform and hope that you will continue on in the future. We can get this job done. The time for healthcare reform is now.